Health stakeholders are calling for the increased uptake and employment of qualified nutrition and dietetics professionals in both the public and private health sectors. According to Kenya Nutritionist and Dietitians Institute Chief Executive Officer Dr. David Okeo, out of the more than 8,000 professionals trained and licensed since 2016, only slightly above 20% have been absorbed into the workforce. This, he says, continues to inhibit the country's capacity to respond to the alarming cases of malnutrition and diet-related diseases. The call to action came to the fore during the 5th International Nutrition and Dietetics Scientific Conference.
A shortage in the number of qualified nutrition and dietetics professionals may derail Kenya's ambition of eradicating malnutrition and diet-related illnesses by 2030.
Our advocacy and emphasis is that we need to have more well-trained professionals to join service delivery centers and also private sector, both private sector and also public sector, so that they can deliver services in nutrition to strengthen health. And why are we saying this? It's because we have realized that more health problems have their roots from poor nutrition.
To counter this challenge, the government is incentivizing the career path to encourage more Kenyans to take up the role through paid internships.
Previously, we had stopped the internship program because of the non-payment. That we talk, we have engaged the Minister of Health. The Cabinet Secretary particularly has already committed to start posting these interns from next year.
Despite more than 8,000 professionals having been trained and licensed since 2016, only a meager 20% have been absorbed into the workforce.
We had a problem with our unit of nutrition being lowered to the level of a unit instead of a division. We expected it to be a directorate. As that we talk, the Minister of Health has a director of nutrition services. But we are concerned as a regulator that that director is still under another director. So it is something we expect that the Minister of Health will be able to sort out so that the nutrition remain with this directorate.
We have a solution when it comes to engagement and service delivery of nutrition in the country. And so engaging more professionals in nutrition can have can strengthen our health systems from the promotive perspective so that we can stop overloading the curative services.
Professionals are now calling for increased resource mobilization to support nutrition programs and eradicate the silent pandemic in a period of 5 years.
Funding is a problem, and we're not just talking about funding, we're talking about resources in general, because then you need funding as part of the resource that we need. You need human resource, but also you need equipment and materials to be able to support the process of reducing malnutrition in Kenya. So that has been a challenge.
According to Nutrition Smart survey findings on the prevalence and the triple burden of malnutrition, an estimated 760,488 children aged between 6 to 59 months require urgent intervention to manage the situation, with Turkana, Mandera, Wajir, Garissa and Marsabit counties topping the list of regions leading in malnutrition.